Very good morning to all. Hope you can able to see my slide and you can able to hear my voice clearly. Welcome to the Safety Saturday and HSC Hub webinar episode 76. If you can able to hear my voice, please say yes in the chat box so that we can get started. Yeah, good morning, sir. Good morning, Jagannathan, sir. Thank you very much. Yes, good, sir. So once again, so we are very much happy to meet you on the Saturday, Safety Saturday, which is 76th episode of our HSCL webinar. So this webinar is going to be around 60 minutes. So be seated in a comfortable ergonomic position so that you can pay attention clearly and also you get the message clearly. Right. So there are people here to join now. So let them join. We start the session. HSC Hub basically a training and education organization based in Chennai. So we provide education and consultation to the industries. And this kind of webinar initiative, we do every week 3 webinars. And Wednesday is a well-being Wednesday. Every Wednesday evening, 7 p.m. to 8 p.m., we talk about health aspects. And Saturday is completely for safety understanding and to create awareness among the industries. And Sunday, that is a new initiative we started every Sunday, not every Sunday, 2 Sundays in a month. We talk about sustainability part, that is Sustainable Sunday. So these are our webinar initiative. As a Health and Safety Hub, we have a holistic approach for health and wellness, building holistic wellness among the industries, individuals, and institutions. We work on the sustainability development goal, a good health and well-being, 3, and other thing is a decent work and environment. So these are the 2 areas we work. Yeah, once again, sir, once again. Yeah, sorry for that. I am right now outside. So yes, so we work on the sustainability development goal, that is 3, which talk about good health and well-being and decent work and economic growth. We create a lot of training and coaching solution through HSC Hub. And we provide 3 different solutions, that is health and wellness, where we talk about individual health and especially to the industries about night shift ergonomics and functional fitness. And industrial safety training is our major wing where we talk about all related industrial safety trainings. And recently, we are focusing on corporate auditing and consulting about ISO, ESG, HERA, POS, and external committee member. And recently, we are working with technologies of creating a VRIR training module and generative AI-based solution for safety industry. So these are the 3 wings we are working as a HSC Hub. We have a group of trainers and experts to create a customized solution to the industries. So in the safety education series, every Saturday we talk about safety, and this week on handling of electrical emergency. Most of you know me, myself D. Arun Kumar. I'm a basically electrical engineer. I'm in the field for the past 25 years. I do EHS and ESG consulting and training. I'm a level 1 thermographer and I'm a lockout takeout specialist. I have completed around 25 lockout takeout projects in Tamil Nadu and Kerala. And today we will deep dive into handling electrical emergency. So basically we know what about electricity, electrical hazards and risk. We understood from the many standards and trainings about electrical risk and things and how to handle in an effective way. So that is the objective of this webinar. As usual, you can get more knowledge and if you need any doubts or clarification, we can discuss at the end. So before going to the webinar, there is a small disclaimer about the webinar. This webinar mainly for educational purpose and we are going to use a lot of medical terminologies. With my knowledge, since I am a health and fitness trainer, I have a fair idea about human physiology and anatomy. So we use a lot of technical and medical terms in the webinar. So if you need a full detail, definitely you have to consult with the experts in medical field and safety field. Always go with a qualified medical consultant and safety consultant to implement in your industries. So this is about the webinar disclaimer. Now let's understand why electrical accident is critical and crucial. See, I'm in the field for the 25 years, I said. I saw a lot of electrocution accident, and I went along with the team for accident investigation. The electrical accident is highly crucial where it is industries or domestic or wherever, because in industry normal accident 300, see like reportable recordable injuries, right? If it is 300, like we call like okay accident, out of 300 one may be fatal. So you can connect with the domino Hendrix theory. So if any industry face 300 general accident, one may be fatal, but in electrical is out of 10, one become fatal. That is the risk of electrical accident. So, if you attending this session, you might have experienced electric shock. There are many people who experience electric shock. They are not there now today. Because what happened, one electrical shock, the first electrical shock may be the last electrical shock for the person. So electrical accident is very crucial in industries. If one got electric shock, he may or may not live in the world. That is the risk of the electrical accident. Now let's understand what are all the other view about electrical accident. There are primarily two type of electrical hazards. One, we know that electrical shock, and that is called as electrocution. Okay, just understand something about electrical shock. Electrical shock is basically when a person become a path of electrical circuit. When electrical current enters to a person, body passes through the multiple organ and reaches the ground. This is called electrical shock. Okay, this will create a lot of internal and external damage that we are going to discuss deep in it. So basically, electrical shock, when a person became a path of the conductor or path of the part of a circuit, that is called electric shock. Okay, the severity of the electric shock, because I also got electric shock many times. Some of you attending the session also, you may also have experienced electric shock in your past. So the severity of electrical shock will be determined by the route of the electric current, path of the electric current. See, if you see the A picture, that is a touch potential. The current electrons enter to one hand and reach ground with the other hand, that is a touch potential. And step potential is B, that is one leg to another leg. And if you see the combination, touch and step potential, this is very crucial in industry because we touch and do some troubleshooting in the equipment, and it also reach the ground through the leg. So when it enter through hand and reaches the ground, it touch all the organs, heart, lungs, kidney, liver, whatever. So it crosses the path. So touch and step potential are the dangerous combination in electrical shock, which will having a capacity, so which is having a capacity to kill a person instantly, right? So the effect of electric shock, there may be plenty. There are people who escaped with a simple single electric shock, and there are other people who may experience these kind of burns. If you see the picture one, it may look like a horrible accident, but it happened by the small electrical shock. Second picture, if you see, complete burn of the muscles and other thing. Because this much serious injury, electricity is having a potential to cause these kind of injuries. And if you see the third picture, whatever the conductor, wherever it touches the body, the electricity pass through. So these are the simple, what I shown is a very normal picture. There are horrible pictures are there, the electric shock burn. So that is the seriousness of electric shock, right? Then other phenomena is electrical arc flash. To define electrical arc flash, it is a short circuit through air. When when electricity passes through air, it releases the high energy. So when the high energy reaches a person, so it will create a permanent damage, and there are many worst and horrible effect on the human body. So basically, to understand what is arc flash, like arc welding, because with arc, so we are doing welding. And you can see in the electrical transmission and transformer, this is also arc. Simply say, if arc happen in a small way, we used to call spark. If the arc with a high energy release, we call it as a electrical arc flash. What will happen to the person? After encountered electrical arc flash, the coverall or the suit may look like this. The electrical equipment panel may go this way. And what about the person? This is the worst scenario of electrical arc flash. Again, I remind what I show in the picture is a very normal affected picture. There are very horrible okay, even happen across the globe. That is why across the globe, NFPA 70E, National Fire Protection Agency, and even Indian latest NEC, National Electrical Code 2023, they are developing a lot of potential or lot of standards to prevent the R flash and to protect the electrical engineers. So having understood electrical shock and R flash, I request you to watch this video. I hope you can able to see the slide in the, okay, you can able to see the video in the slide. Okay, and please watch this video, and after this we'll discuss further. One person has got electric shock. The other person is coming to save the person, but unfortunately, he also electrocuted. Third person is coming, and this person is have some consciousness towards electric shock, and finally he disconnect the power and he try to do something. Because why I'm showing the video is, whatever the knowledge, whatever the emergency management system we have, practically if anybody see the electrical shock, this may be the reaction. So which is very, very worst. Even there are some cases where a person, okay, went for emergency management and finally he died. There are many reasons. It happened in fire also, right? Now let's understand what electrical shock can cause to a human being. Like multiple organs, I have took only 3 systems. What will be the consequence in a human body? The effect on the heart. Normally, the human body, all the parts of the body working with the intrinsic, that is internal electricity, we used to call in a non-technical term. To beat for heartbeat and to have our ortho movement, hand and leg movement, to the entire body function, the entire body working with the, excuse me, sir, someone can mute? Yeah, once again, I will just mute all so that it will be very, yeah. Yes, yes. Yeah. Sorry for that. Now I muted everyone so that we can continue to have the session. Right? Fine. So our entire body is working with electricity, let it be brain or heart or our all the body and and the entire system is functioning with the electrical pulse, that is internal electrical pulse. In non-technical terms, we used to call every human being having a electrical power of 70 to 100 watts of electrical power. Okay. So since heart is predominantly working with the internal, that is called it is called intrinsic electrical signaling. So the external electric shock, when it reaches the heart, the cardiac muscles, the cardiac muscles which make the heart to function, loved up rhythm we used to call, right? So what will happen? The cardiac muscle will get affected, and the electrocution is laid to the arrhythmias. Okay, so this one, what is it? It is basically irregular heartbeat or ventricular fibrillation. It means when somebody got electrical shock, there is a conflict between the external electrical current and body inside, that is intrinsic electrical signaling. That conflict lead to the ventricular fibrillation. Okay, it means heart will not function properly. What happened to that? What is the consequences when heart is not functioning properly? The circulation, the blood circulation will get affected. Okay, to understand more, I'm going to play another video where you can understand very well how an electrical shock will disturb the heart rhythm. So this is normal ECG where you are seeing in the normal heartbeat will be 70 to 80 and 90 based on the person, based on his normal heartbeat. So during electrical shock, the heartbeat will go to the abnormal speed. This stage is called ventricular fibrillation, where the heartbeat will be irregular and it won't allow the blood to pump. So this is the first effect on heart by the electrical shock. And there are other effect is the, okay, which one is called the permanent heart dysfunction because of the myocardial tissue, the which is mentioned in the picture. What will happen when the electrical current pass through the person and it travel through the heart? So it will make the heart function completely stop. What happened? Especially more than 2 seconds, if a person has encountered electric shock, so it will reduce the okay, it will affect the heartbeat, and also it will create a situation called hypoxia, means that is oxygen, lack of oxygen to the heart. Lack of oxygen to the heart, what will happen? It will increase the risk of heart attack. That is why in many cases, anybody got electrical shock, they suddenly collapse. There are some other reasons. We are also going to see, okay, in the upcoming slide. So more than 2 seconds of electrical shock experience can stop the heart instantly because of the myocardial tissue damage. And other impact will happen to the heart is the blood clot. What happened? It is because of the electrolyte imbalance. When an electron pass through the person's body, it can disrupt the electrolyte of blood. Okay, electrolyte like a combination of sodium, potassium, and calcium ion channel. What will happen? It will create a instant blood clot. The instant blood clot will not allow the blood to pass to the important organ, especially like brain. So when there is a sudden blood clot in the blood vein, it can cause stroke also sometime. So these are the three adverse effect on heart by the electric shock, electrocution, right? Hope you understood about the what happened in the heart during electrical shock. Then next important organ which considered to the major organ of the human body is a skin. There will be a severe burn that is called third degree burn will happen. So electrical burn differ from person to person. It is differ from thermal burn. It will create a deep tissue destruction. It means the skin will not recover on its own. See, normally we know that there are 3 degree of three degree of electrical burn or general burn. The first degree means if the cell regeneration will take place, and second degree means with the proper treatment and proper lifestyle, the skin regrowth will be there. But in third degree, cell will not grow. So in electrical shock, directly the person will face or the skin will go to the third degree burn due to the many reasons, because our outer, that is the external layer of skin, will have a high resistance. Wherever there is a high resistance, there will be a heat generation. Wherever the continuous heat generation and the intensity, it can cause third degree burn. Okay, and the saddest part and sad part of the electric shock is that it will create coagulation narcosis. Okay, necrosis. What means? It will create a irreversible cell death. What will happen? Cell will not regrow again. Okay, sometime what will happen? Cloth can catch fire, it can stick on the person body, so that the heat, thermal energy will go into the body and it also disturb the skin. It will completely damage the skin. And there are large amount of ultraviolet and infrared radiation, so which will make the skin in a worst stage. It means it will not regrow, it will not give any protection. Even after treatment also, the skin will not give protection against some bacteria and other viruses, right? So these are the effect on skin by electrical burn. A third part is very, very important, which was not discussed in many places. Now we are going to talk about the effect on neurological system. It means, okay, in our neurons, nerve system, and especially our brain. So what will happen? So by seeing the picture, you might have understand. Whenever we think, we speak, we do some act, there is a electrical movement in our neurons that is called a neural firing. See, now you are attending this webinar. When I say some word, if you can able to connect with your workplace, then your neurons getting fired and it will remind you something, right? So this neural fire will happen because of the internal electrical pulse. So what will happen when a person faces the electrical shock? The neurophysical dysfunction can happen. What happened? Already I told you there will be conflict between external electricity and internal electricity. So it will completely disturb the body communication system. So the brain will not think, the brain will not give any command. So it is called a neurophysiological dysfunction. Means simply say body-mind coordination. Right, and the excess pass of electricity also when it over stimulate the neuron, so it will cause unconsciousness. That is why suddenly a person collapse due to the unconscious. So overstimulation of neuron also can happen with the electrical shock, and it can permanently destroy some neuron, and it can go up to brain damage. That is called biological death. Okay, so the neurological effect when even a person death is one phenomena. Even if the person survive also, he may face some neurological problem after recovered from electrical shock. So this is the one impact can happen to neurological system. Other thing, this I heard from many people, many areas, when low voltage shock, globally 100 volt is called low voltage shock. The low voltage shock may cause temporary memory loss, confusion, and difficulty in concentration. It is temporarily, right? It is okay, acute one. Okay, he may forget something. Some time he may forget his name also. That is low voltage shock impact on the brain. That is neurological system. Okay, in the case of high voltage exposure, like more than 600 volt considered to be a high voltage, it can affect hippocampus, which is in the brain, which can create a permanent cognitive impairment. Mean they 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 are not no more a electrical person after the electrical shock. Even it can go up to dementia, like kind of symptom, the person will forget something. So this is one of the dangerous neurological effect by the electrical shock. Right now, I am talking about shock only. Let's discuss more on the arc flash. Right. Then this one, and after the electrical shock, even after road accident also, person will share, I lost smell sensation. Synaptic transmission means sensory organs may not send signal properly to the brain. Somebody may lose the smell sensation, somebody will lose the one particular part, they won't feel the touch feeling, right? So this one can happen, loss of sensation, muscle weakness, and paralysis. Okay, synaptic transmission may get affected. Okay, and it will reduce the signal transmission even after recovery. So that means after the accident, people will say, my right hand, I am unable to lift it. After the accident, I am unable to sense some smell like that. So this can also be another effect, but it will not happen to all in the all accident. It depends on the impact. It depends on the person age. Okay. So right now we talked about the effect of shock on heart and effect of shock on skin and effect of shock about on our neurological, that is a brain system. Apart from this, after any electrical accident, even shock or there will be a psychological trauma. Means post-traumatic stress disorder, PTSD. It is after surviving the electrical shock, they may repeat itself. Okay, it's like flashbacks. Okay, they will relive again how the accident happened, what was his position. Sometimes it will come in a dream also, which will not allow the person to be normal. It will create anxiety. Okay, so, okay, it will create some anxiety on the person. This is another psychological trauma, one thing, right? And depression and anxiety, what will happen after the electrical accident? Maybe it might have happened 6 months back or 1 year back. The person will have always fear on the electrical equipment and he will not mingle with the team. It is social withdrawal. Like I will share one example here. It happened in Chennai. Okay, he's one of my very good friend. He's an electrical engineer. He worked in industry for 20, almost he is completed 25 years in electrical department. He encountered one electrical shock around 15 years back. That time I was in Madurai. So after the electrical accident, what happened? He went to the traumatic situation. The extent what happened is he is not confident to switch on. Switch on a fan also in his home. What happened after the industrial electrical accident? He survived, nothing has happened. He is normal, but his psychological trauma was huge, intense, and in home also he will call his wife to switch on the light and fan. That much impact he had in his mind. Okay, like a psychological impact, right? So these all the psychological things can happen. And some people, there won't be a real pain, but his nervous system will always give a communication that there is a pain in hand, there is a pain in leg, like that. So these are the psychological trauma can happen to the electrical engineers after the electrical accident. See, I'm in the field for the last 24 or 25 years. I mostly working with the electrical engineers. So these are the point I got it from the electrical engineers feedback, what their team encountered after the electrical accident. Okay. Hope you got some fair idea about what will happen after the electrical shock, after the electrical arc. Now coming to the today important action, emergency management, electrical emergency management. So every industry will have an emergency management plan for fire and chemical and other thing. What I suggest is we should have an electrical emergency management plan. See, whenever we do the non-routine work, whenever we do the some high risk activity, we should have a separate emergency response plan, and there should be a separate a team who know the roles and responsibility and action to be taken during the electrical accident. See, normal fire accident handling is different and electrical emergency management is different. The first action and medical response all are different. So we need to train our team to face the electrical emergency, right? And they should have a complete call matrix, emergency contact number, and which is the nearest hospital who take care of this kind of emergency. So we should have a proper plan in our crisis management manual. Okay. Now, after having understood shock and arc, there is a basic difference. When shock means the current passes through the person body, when arc means current or flash on the high intense flash on the person. So here there may not be the much amount of current flow, but there will be a high energy intensity. Okay. Now let's watch the small video. Okay, it was created by an industry to train the people internally. But watch the video and understand how people respond to the emergency, real emergency. So this is a very short video. Okay. This demonstration is like a mock drill they did. Okay, this mock drill. So you might by this time you might have understood what was the mistake. The person is going very close, and one person removing his shirt to save the person. The person is not worn gloves, and there is no protective equipment, and unfortunately there is no electrical insulating mat. So if this case in a real situation, what will happen? All two or three will be in trouble. Normally we will say yes, whenever there is electrical shock, the circuit breaker will operate and it will disconnect it. Okay, it will isolate the plant and everything. But we need to ensure. Okay. See, in our latest industrial scenarios, we have a lot of protective systems like circuit breaker, and there are many things are there. But still, after electric shock, we have to confirm whether the line is disconnected or not. And especially the non-routine and high-risk work, so we need to, the person or the team working in the electrical work, they should understand, they should know where is the main switch. As soon there is emergency, they have to isolate the area, right? So, okay, once it is done, then what next one? So now if the person may hold the wire, he may in contact with the electrical connection, and how to release the person from electrical connection. Okay, even if it is isolate also, again here very important point here, whoever the person go for electrical rescue, they should wear electrical insulated gloves. They can claim I'm using the non-insulated, insulated stick. I can remove the person hand, whatever it is. But without the rescuer protection, rescuing the victim is very much challenging. So whenever a person is going for an electrical shock rescue, he should wear the proper insulated gloves. And he can take some insulated stick and he can try to remove the wire. If it is not there, is there any advanced system? Yes, there is a rescue hook available, insulated rescue hook, which is around 6 to 8 feet length. There are different sizes are there. So this is a completely certified equipment where every 6 inches of this, every 6 inch of the entire hot stick, this name is called hot stick. So by using the hot stick, it is completely insulated and we can rescue the person. So this is the professional way to rescue the person from electrical shock. Right. I'm going to show a video how it works.
शौक लगा 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 शौक लगा 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 लगा शौक लगा 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 शौक लगा लगा
So clear. So now that old system and new system, there are a lot of advanced equipments are there. There are that insulating mat is there, small mat, and they should have a proper insulation blanket, whatever it is. But we have to use the proper insulated tools or insulated stick to remove the person from electric shock or that from the panel wherever he is working. So after once you rescue the person from electrical shock, then we have to check whether the victim is conscious or unconscious. Okay, if he's unconscious but breathing, okay, unconscious means sensory inputs are not going. You are calling the person by name, he is not responding. You are touching the person, he is not responding. But there is a breath. Okay, when breath is there, then we have to put them in the recovery position, that is side laying position. Then, if there is no breath, then we have to start CPR, cardiopulmonary resuscitation. And you should know whenever a person is working with the high voltage or high risk electrical maintenance, there should be a person who knows CPR well. So he should be on call. Okay, he should be near on call. So we have to do CPR. Then what? So we have to look the entry and exit wound. Okay, it will happen in high voltage shock where the current enters and where it exits, there will be a small wound. We have to check, we have to cover with the sterile cloth, and we have to check for other impact like a bone fracture or some skin scratches, something like that. Okay, we are not supposed to use any normal first aid box, whatever the ailment, whatever it is, we are not supposed to apply immediately. So after the medical profession only, medical screening only, we have to go for this kind of application. So now, first thing, so we need to have an emergency team exclusively trained for electrical emergency. In fact, if you want to conduct this kind of electrical emergency mock drill and management, definitely health and safety is ready to do that. We are completely equipped with this concept. So this will take around 1 hour to 1.5 hours. We can come to your industry and we can do like a electrical emergency mock drill with all the protocols, right? So once you remove the person unconscious, put him in a recovery position. Okay, if he is not breathing, then start CPR. Okay, how to do the CPR? Whoever is knowing the CPR well, if you are attending a session, if you want to know what is CPR, I'm just showing one small video about CPR. Just open the airway and locate the heart and give chest compression. Cardiopulmonary resuscitation, CPR. So what I'm trying to say is here, in the electrical emergency management team, all should know how to give CPR, how to give breath, how to give chest compression. Otherwise, the intensity of risk will high. If the person is trying to do something on its own, then it will not work out. So whenever the person is working with the high risk of electricity, there should be a rescuer who know about CPR, right? Right. And what about next? So shock can cause ventricular fibrillation, we saw that. And there is another equipment you can have. And especially in high risk activity. In fact, many industries in Chennai, they have this equipment called AED, automated external defibrillator, because it will quickly assess the person. It will give a shockable rhythm, shock to the person, and it can easily recover the person from that unresponsive stage. So either or till the AED is coming, till the AED arrive on the spot, then we can use CPR. If you have a AED, then immediately we can use the equipment, hot start AED. So what it will do, it will analyze the person heartbeat. Once it understood whether it is ventricular fibrillation or not. So if it is ventricular fibrillation, it will give some shockable electrical pulse. So it will reactivate the heart. So how it will work? There will be two electrodes. So we have to stick it on the bare chest of the person, and we have to switch on the AED. It will completely analyze and it will give a shock and it will recover the person. So this is one.
A safe
Yeah.
station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we
It's
all
not only for
understand what to
electrical
do
shock.
until medical help
We can use it
arrives.
for any
Because
kind
every
of
second matters.
unresponsive victim.
Zach, are you okay? Zach, can you hear me? Can you hear me? Zach, can you go call 911, tell them we have an unconscious male, and report back to me once you're done?
Yes.
Perfect, thank you. Kate, can you go grab the AED from the safe station? Do you know where it is?
Yes.
Bring it back to me once you
Okay.
get it.
Unusual breathing, or gasping, is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. Peel the second pad from the yellow plastic liner. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flag.
So it is that much simple to use. Just prepare the patient, remove the shirt and attach the pad and switch on the AED. It will completely monitor the ECG. If shock required only, it will deliver the shock. So it is very within 30 seconds, the victim may get recovered, right? So these are the protocol and process we have to do it for electrical shock emergency management. So once the person come to the normal stage, again this point is very important. Even the victim appears to be normal, we have to continuously monitor the ECG, because if a person has got electrical shock and went unresponsive stage, again he can go unresponsive. So we have to completely, we are not supposed to remove the AED from the person chest till getting the medical evaluation, medical screening. It needs to be there with the person body only, so that if a person is again go for unresponsive state, then it will again give a electrical shock or electrical pulse. It will try to maintain the person active condition, right? So it is very important. Okay, hope you got some rough idea about electrical shock management. Okay, emergency management. Now coming to the second part, electrical arc flash. As I told you earlier, electrical arc flash means there is no current inside the person, or there is no current entry into his body, only the high intensity of arc. So here the situation is different. We have to treat in a different way. So here it is very important. Many places, why they are not able to rescue the person, recover the person immediately, is the poor emergency management for electrical arc flash. Now let's understand what will happen to the real electrical arc situation. Just watch this video. See, again, he's luckily got escaped. But see, again, you watch that practice, there is no gloves, there is no proper boundary, nothing is placed. Actually, prevention is better than cure. That is the right one, because there should be a proper protective equipment, and especially when a person opening the electrical panel, and you should wear the arc rated gloves and suit, and there should be a proper boundary, right? Now let's watch another animated video. What will happen in the electrical arc flash? See, electrical arc may happen less than a second, but the impact is huge.
This explosive condition includes a broad spectrum of electromagnetic energy, plasma, fragments of damaged equipment, and molten metal from the destruction of conductors at the point of the arc flash. What does this really mean to you? Consider.
So the understanding is electrical arc flash can happen in a second or less than second. It release huge amount of heat and it's also release the plasma arc. There will be a molten metal splashes. There will be a brittled metal parts. There are many things will attack a person. Okay, impact a person less than a second. So here the emergency management is little different. Okay. What are all the things we need? First, we should have a proper emergency equipment. Okay, like special first aid kits and sterile water and water gel blanket. Okay, I will show what is water gel blanket and all. And also there should be, I hope all fire extinguisher will get installed, but we are not supposed to use powder. Okay, in this kind of situation, because when the powder reaches the burn, it may also create a infection. So better to go for a CO2, but not to use on the person body to extinguish the fire, electrical fire. So there should be a proper emergency management equipment with the gel and other thing and proper fire extinguisher and preferably CO2 gas. Okay. Then how to treat the arc flash burn? It is very important. First, do not remove the burnt clothing. It is very important. If you remove the cloth, what will happen? That the skin will get peel off, then treatment will be very tough. Even with the advanced medical system also, it is very tough. So we are not supposed to remove the cloth immediately. In case of it is bone and other thing, again have a sterile gauze or cloth. Okay, don't use avoid cream, don't use water and other cream. Just cover the burn with a sterile cloth or gauze. Okay, and in case of any facial burns and other thing, check the airway. Okay, whether the person is breathing or check the airway, I mean throat area, how it was affected. So these are the diagnosis we have to do. Okay, so that is assessment. So we are not supposed to remove the cloth, cover the burn with a sterile cloth or gauze. Now, if your company, your system have water gel is a completely sterile one. It will not stick on the wound. It will reduce the temperature drastically and it won't allow any infections. Okay, it won't allow any infection and it will also reduce the pain. Okay, what it is water gel blanket? It's a kind of a semi-solid gel drenched in a cloth. So that cloth is called a water gel blanket. Just apply it on the person body, even with cloth also possible. Whatever the video I'm going to show, it is without cloth. So even we can apply the water gel, okay, above the cloth also, right? Sterilized one. So just apply, cover the bone. Again, I am saying here in the video, it is with the bare chest. In reality, if the skin cloth completely stick with the person body, okay, you can directly place the blanket on the person body. Then immediately taking to the hospital. That is next we have to. So this is the one thing will reduce the pain. Will see basically what huge amount of cooling will not allow the heat to transfer to the body. It will also try to come out. So it will reduce the intensity of injury. Okay. So this is the one we can do for a arc flash burn. Again, whatever I am narrating here based on the normal situation, reality normally or many times it is uncertain only, but we should have a proper system. Applying water and searching for a banana leaf that may not available, that also will not give right solution. Only the proper medically certified gel can reduce the burn intensity. Okay, next one. So then okay, arc flash also come with ultraviolet radiation. Okay, in case if nothing is like a burn is less, only he may got some facial burn or small burn like that, then you can have a saline water. So again, it's not normal water and you can cover with a sterile cloth. Okay, so in case person is having some okay, again what will happen in our flash, the wire, the insulation, the paint and other thing can create a toxic smoke. Then you need to check the whether the person is breathing or not, whether he is breathing also. Okay, if the person is breathing also, whether it is right or he is having some difficulty in breathing. So this all we have to observe. So that see why we need collect this kind of details. We can inform to ERT team, we can inform to okay occupational health center what was the condition of the victim. So these all things. Then after the arc flash, even the person is conscious, he may not be normal. Okay, he may experience confusion or some panic situation. He may not walk properly, and he will do some okay, like a shock victim, right? It's a kind of traumatic situation. So we have to observe, and you have to call by name, and you have to say your name. Okay, you have to try to build a conversation. When you try to build a conversation and ask something, if the response is not proper, then you have to understand he is at some trauma. Okay, so here controlling the conscious victim after arc flash is very difficult. So you should have courage to hold the person or courage to move the person from the accident spot. Okay, but get a help from your team. I hope you are understanding. This point is very crucial because the person may not listen whatever you are saying because he is in trauma stage. Okay, so monitor the delayed psychological symptom that is after the accident. Okay, then evacuate to the immediate to the medical facility. For a shock victim, we can give CPR, we can give AED, we can do whatever the things. But in our flash, only professional medical support is very important. Or it is the only thing I can say. Even if you have the occupational health center, they may not that much trained to handle this kind of situation. So better to take the multi-specialty hospital and start the treatment immediately. Okay, and also inform the persons, hospital people about the arc flash. They may be knowing. If they don't know what to do, they will treat like normal fire burn. See, there are thermal burn is different, normal fire burn is different, arc flash burn is different. Because arc flash, it is not only heat, it is a pressure, it is radiation, it is impact, everything, right? So that's why. Okay, right. One second, I'll share my slide again. Okay, right. So after the person reaches the hospital, then they have to start the whatever the training, what are the treatment they have to start. Okay, and they will know what to do. Okay, fine. One second. Psychological risk works so that then evacuate to the medical facility, right? So to sum up the emergency management for electrical shock and arc, this one slide will say, first understand the scene, okay, scenario, disconnect the power for electrical shock and use insulated tool. If the person is holding the wire, remove the wire with a non-contact, it is insulated one, and check pulse and try to do CPR and AED. In case of burn, cover with the sterile cloth and watch for the person response, neurological effect, and immediately go to the medical evaluation. That is for shock. For arc flash, avoid secondary arc exposure means we have to disconnect the power. There should not be again arc again. Remove the person from danger area, mean that particular spot, and assess the airway and apply CPR if needed. Again, when the person, see here, when the person is with more arc flash burn, we may not able to do CPR. Immediately put the water gel and take him to the hospital, right? And in case if it is less or small arc flash, then if the person is need CPR, if you can do that, then you can do, right? And monitor the person continuously for respiratory, that is breathing, and also some psychological effect, like whether the person is responding normally or not. Fine, sir. So this all the emergency management we need to follow as a protocol during electrical shock and electrical arc. Okay, so with that I am stopping the session. Okay, now it is 11:50. So now we can take some couple of questions. Hope you got some overall fair idea about what is shock, what is arc, what should be our preparation to prevent the emergency. Even in the emergency happen, what is the procedures and how to handle shock and how to handle arc. Any questions you can ask now. If you understood something new also, you are welcome to share. I am right now outside, so I am having some Okay, a poor signal here, but still I try to manage it. Okay. Yes, and there are some videos also available in our YouTube channel, Health and Safety Hub YouTube channel. Around 100 plus videos are there. Our previous webinar and a lot of safety webinars are there. You can go and watch. You can get benefit more about it. And if you want to contact us, if you want to work with us, we are also giving the multiple solution on safety. Not only is it is electrical and holistic health and wellness we do. Good health and well-being. We do a lot of activities, and this kind of industrial safety also we are doing. So you can connect with us. So this is my contact details. You can contact us anytime, or you can send your requirement to the registered email ID. Our team will respond to it.